Hi, I'm Dr. Yu. I'm a facial plastic surgeon here in Beverly Hills, and today I'd like to discuss the experience of one of my patients who underwent male rhinoplasty. Kevin is one of my patients who suffered for a long time with issues breathing through his nose, nasal obstructive symptoms, and who disliked the appearance of his nose.
I wanted to get it done to improve the tip of my nose and my bridge to give me a more refined and focused look. Also, I wanted to straighten out my deviated septum in hopes of alleviating some of my severe allergies and sinus congestion.
He has had previous surgeries to try to correct the septum or the structure inside the nose that divides the left and right nostril. And despite that, his breathing has not been optimal, and he's had difficulty, especially with great physical exertion, breathing well through his nose.
I have really bad allergies all year round. I have to take 3 allergy shots per week for my allergies, just to be able to breathe better.
He also came to me because he was looking to create greater height for his nose overall and a nose that would match his face. We discussed options for him in terms of improving his airway and his breathing, as well as improving the appearance of his nose so that it gave him a more masculine, handsome appearing nose.
Dr. Yu was really patient. He was really understanding about my problems, and he led me through a process of what he would do to my nose to improve it.
For Kevin, he had had previous surgery on his nose to try to straighten his septum and improve his airway, which was not successful. And so I discussed with him options to create greater success for that aim, which involved using rib cartilage, because rib cartilage provides strong, straight material. Besides the septum, which divides the left and right nostril, the nasal valve area is critically important in breathing, and it's the area where the side of the nose meets the bridge. This is the point of highest resistance, and widening that area, making that area larger, creates a greater cross-sectional area for air to move, and thus will result in better breathing. Male rhinoplasty is challenging because it's important to preserve the characteristics of the nose that keep a masculine appearance. Along with that comes a little bit of a straighter profile, some greater volume and fullness of the tip of the nose, and at the same time improving breathing. So with Kevin, I'm thrilled that we were able to preserve his masculine appearance and even enhance it while improving his breathing along the way. The surgery itself was under general anesthesia, so Kevin was completely asleep and he did fantastic. At 2 weeks, the nose is at the point where it's presentable, but certainly far from the final shape. The majority of the swelling will take 3 to 6 months to resolve, and the final shape will be present in 1 to 2 years. But already, even with the swelling, you can see the increased definition and refinement of his nose, the greater height of his bridge, and the overall lengthening to create a more masculine and more handsome appearance.